Would you trust an algorithm with your healthcare decisions? UnitedHealthcare and Humana, two of the biggest health insurance companies in the United States, are in hot water over an algorithm. A lawsuit alleges that these insurance companies use an algorithm for a, quote, fraudulent scheme to stick elderly beneficiaries with healthcare expenses or leave them lacking medical care that was supposed to be covered by their insurance. The lawsuit further alleges that these insurance companies reaped a huge financial windfall from this effort. I mean, of course they did. Why would anyone do fraud unless it's profitable? That's like fraud 101. Now, I'm not a lawyer, but I do know a lot about algorithms, and I've spent a great deal of time digging into this algorithm to see if I could figure out what the frack is going on here. And it's worse than I thought. The lawsuit levied against UnitedHealthcare in the state of Minnesota, where the company is headquartered, is brought by the estates of two deceased former customers who claim that they were denied coverage by the insurer. It seeks class action status. The lawsuit claims that UnitedHealthcare is using an algorithm to override the medical judgments of doctors in order to deny critical care to elderly patients. This allegedly led to patients getting discharged from rehab facilities too early, or forced them to pay out of pocket for care that should have been covered by Medicare Part A. For anyone who isn't an American over the age of 65, or for those who are and just find Medicare confusing, because I would, according to the Medicare.gov website, all Medicare Advantage plans are supposed to cover at least what Medicare Part A and B cover. The similar lawsuit levied against Humana in the state of Kentucky, where Humana is headquartered, is brought by two former customers who luckily did not die, but alleged to have sustained huge financial losses as a result of being denied coverage by the insurance company. In both cases, the plaintiffs allege that the insurance companies used an algorithm to estimate the exact dates of their discharge. The insurance companies refused to pay for any rehab after that date. Now, I don't want to read the stories of the plaintiffs in this video because I'm here to talk about algorithms, but if you're interested and you're watching this video, I'll link some articles in the description that cover the exact stories of the plaintiffs in this case. And if you're enjoying this video, please give it a like so that I know to continue to follow this case and I can post updates as they become available. Thank you for doing that. So the algorithm is called NH-Predict, and it was developed by a company called Navy Health. It was originally intended to forecast how long a patient would need post-acute care or occupational rehabilitation or other similar services after a medical appointment. The algorithm works by comparing the patient's age, diagnosis, living situation, and other factors to other similar customers in a huge database, similar to how property and casualty insurance companies try to forecast how much it would cost to insure a person's car or house. I can see how this would be useful in forecasting how much it would cost the insurance company, for pricing and whatnot. But anyone who's at least 1 year into a statistics degree should be able to explain why it's not a good idea to use an algorithm to forecast hospital stays, especially if the insurance company is going to trust an algorithm over a physician. And that reason is there are way too many other factors, in statistics we call them confounders, that can affect humans. Algorithms are based off of math. Humans, we're not math. We're not a math equation. And some of these confounders aren't even apparent, and they aren't even based off of a mathematical function. There's just too many non-mathematical reasons why somebody might overstay in a care facility. Now don't worry, this issue gets worse later on in this video. Now looking into these lawsuits, both of the lawsuits claim that this algorithm has a 90% error rate. When I first read this, I was shocked. I thought it might be a typo. I had to go through and do more research. A 90% error rate, just to me, this was the most shocking thing about this case. If this is true, it means that this algorithm is frankly horrendous. A coin flip has a 50% error rate. So having a 90% error rate, to me, I just don't know that anyone could do that on accident. Any machine learning engineer who develops an algorithm would get a swift kick out the door if they couldn't beat a coin flip of 50% error rate. Most algorithms wouldn't even be considered statistically useful unless they had an error rate of 10% or less. In my professional opinion, getting an error rate of 90% would almost have to be deliberate. It's unbelievable. And I don't even know what to say about whoever thought that it was a good idea to put an algorithm that had a 90% error rate on the market for people to buy. But I can't help but notice that a 90% error rate would be the inverse of a 10% error rate. Remember I said a few minutes ago,
most algorithms wouldn't even be considered statistically useful unless they had an error rate of 10% or less.
So it kind of makes me wonder, did they just read the results wrong? Did they look at the results and go, oh, it has a 90% error rate when they really meant a 90% success rate? I don't know yet. I have to see this algorithm and look at it a little bit more. Both lawsuits do allege that UnitedHealthcare and Humana knew how absolutely horrendous the algorithm was, but that they continued to use it anyway in order to cut costs and avoid paying for expensive care that their customers needed. And the plaintiffs are suing for breach of contract, unfair dealing, unjust enrichment, and bad faith insurance violations. That's a lot. And they're seeking damages for financial losses, emotional distress, and they want to have these insurance companies barred from ever being able to use these algorithms again. I mean, that makes sense. So here's what I know about these algorithms. The algorithm NH-Predict by Navy Health is not only being used by Humana and UnitedHealthcare. I did find evidence that it is also being used by Blue Cross of Pennsylvania, West Virginia, and Ohio. Most people don't know this, but Blue Cross isn't actually one big company. It's actually several smaller regional companies that all share branding and, in some cases, resources. This is the only Blue Cross regional conglomerate that I could find evidence of using the NH-Predict algorithm. Now, before anyone takes a pitchfork to Blue Cross, I was able to find some documents that had Blue Cross's branding on them that directed people on how to use the NH-Predict algorithm. It specifically states several times that the algorithm is intended to be kind of like a starting point for judging the hospital stays, and that it's not supposed to be used to override the opinion of a physician. And I can't find any evidence that Blue Cross is using it for anything more than a starting guideline, or that they're using it to override the opinions of physicians, but actually that they might be doing exactly as the directions state. So this kind of implies that if something truly nefarious is indeed going on here, that it seems like Navy Health probably didn't engineer it, because why would they tell a regional Blue Cross company that it's just a starting point and doesn't override the opinions of doctors, but then neglect to tell that same information to both Humana and UnitedHealthcare? That wouldn't make any sense. Now, of course, you, the viewer, would probably want to know if any of the other health insurance companies are using this algorithm. And I can't check all of them, but I can check the publicly traded ones and look through their financials a little bit. CVS, which is the parent company of Aetna, has stated numerous times on earnings calls and in their documents that they file with the SEC that they use artificial intelligence for stuff. And as a result, their stock has risen higher than stocks of their competitors because investors like to pay a premium for artificial intelligence, at least for now. However, I couldn't find any evidence in their SEC filings that they were using this specific algorithm, the NH-Predict by Navy Health. And after looking at the wording in their reports and comments by their CEO, it looks like I'm going to go with probably not, just based off of what they're using artificial intelligence for, and then knowing now a little bit more about what the NH-Predict by Navy Health does. Also, as a side note, CVS's CEO's name is Karen, so maybe she has an in with the manager at Navy Health and knew not to use this potentially horrendous algorithm. Unknown at this time, and Karen, the CEO of CVS, was unable to be reached for a comment. I also combed through the SEC filings of another giant publicly traded insurance company, Cigna, and I couldn't find any evidence of them using the NH-Predict algorithm either, even though their CEO isn't named Karen. Now, I was able to find an internal document with Humana's branding that stated that this algorithm the NH-Predict by Navy Health is evidence-based and based on a database of 6 million patients. So Navy Health backs a lot of scientific research in the healthcare field, and annoyingly, a lot of their papers have similar titles, which makes it really hard for people like me to search through everything, especially since I'm not a physician or, like a biologist. I did ask a good friend of mine who is a biologist to help me do some research. But however, we were not able to track down those several scientific studies that were stated in Humana's file as being used to predict the NH-Predict algorithm by Navy Health. And furthermore, there was no footnote or bibliography or anything in the Humana documents. However, my friend was able to help me figure out that this algorithm seems to be based on a previous version of a predictor algorithm that was produced by Boston University. And if something is going to be based off of 6 million patients' medical records, I guess Navy Health would be a good candidate to be able to have that data, considering how many scientific studies they have financed. So this begs the question, if the algorithm really does have an error rate of 90%, why is it so bad? So I decided to call Navy Health and ask them for a copy of the algorithm.
Hi, you've reached Navy Health. This is Cindy. How can I help you?
Yeah, hi. I'm a PhD student and YouTuber with a following of about 7 people.
Okay, and how can I help you?
I'm doing a piece on the algorithm of yours that Humana and UnitedHealthcare are being sued over. I want to make sure I get all my facts right. Can I have a copy of your algorithm?
Yeah, so even though I wasn't able to get the NH-Predict algorithm to look at, I was able to do a deep dive on Google Scholar to look up the AM-PAC algorithm created by Boston University, which is supposed to be the predecessor of the NH-Predict algorithm. So here we find the Boston University PhD dissertation of Diane Jette from 1994. This appears to be the origin of the AM-PAC algorithm. She's the foremost expert with lots of papers on the topic. Her dissertation is not available for free, but as a PhD student, I do have a ProQuest account, and I was able to order a copy. Now, she did 3 medical studies, and all of them had an error rate of 10% or less, which would be expected from a dissertation. Any sort of anything that anyone who knows anything about algorithms puts their name on should have an error rate of 10% or less. And as someone who went to MIT, I guess I will have to grudgingly say that Boston University is an okay place to go to school. I also want to note that after reading her dissertation, it looks like Jette's algorithm was designed to look for trends in hospital stays, and it was not designed to override the discretion of a physician. In other words, it's designed for research purposes, not for diagnostic purposes. And in her conclusion, she actually states that the physician's opinion should be regarded higher, and regardless of what the algorithm predicted, every patient in the study actually benefited from more post-care rehabilitation, occupational therapy, physical therapy, whatever the case may be. Now, we also have this news article from Clinical Trials Week that reports on the results from a 2015 iteration of Boston University's AM-PAC. Remember, Jette's paper was from 1994. So you can see there are some numbers posted, and basically this means that the algorithm produced an error rate of 5%. So they've improved it. And then we have this paper by Burgess and Jensen, who used Boston University's AM-PAC algorithm to aid in their study of patients with brain tumors. The AM-PAC was used to measure the level of assistance these patients required with daily activities, which were listed as putting on and taking off clothing, bathing, going to the bathroom, showering, and eating meals. The paper does cite other papers that were produced by Jette and collaborators. Burgess and Jensen's paper identified 60% of their customers that needed occupational or post-care therapy. And the stated range of occupational therapy, meaning the number of times that these patients went to see an occupational therapist, was between 1 and 18 times, which is a pretty big spread. I had to step away for a second. My dog was desperate for attention. I guess nobody ever pets him. So, back to this. If the health insurance companies are using something that is very close to this AM-PAC algorithm that is shown by Burgess and Jensen, they're not using it correctly, to be frank. The way that Burgess and Jensen is using this algorithm is similar to how Jette used it, which was for research purposes and not for diagnostic purposes. Now, I want to be clear that these papers I've brought up by Burgess and Jensen and Jette and collaborators were all approved by institutional review boards, and they went through the peer review process that would be required for publication in this way. They're doing really good research. They're doing fantastic research. The algorithm looks like it's really good at predicting hospital stays. For research purposes, once again, not for diagnostic purposes. And also the AM-PAC by Boston University, as much as I would like to shit talk Boston University, it's not the same exact algorithm as used by Navy Health. It is a version, an earlier version. Navy Health claims that their algorithm is proprietary and that nobody should be able to look at it and nobody can look at it. Because of course they do. And it looks like Navy Health alleges that their algorithm's prediction of therapy intensity will not vary during the duration that the patient is in care. This strikes me as a problem for obvious reasons. So I obviously was not on the committee that created this algorithm. If I were, I potentially would have seen why this is a problem, and I don't even work in the medical field. So I'm a little curious as to why this was allowed to be the case. It's not the algorithm team's job to establish policy about whether or not the insurance company should take the word of the algorithm over the provider. I mean, you would think that the insurance company would know better than to trust an algorithm, but they're not algorithm makers. They're potentially just, laymen. So they might not even know. If I were the head of this team creating this algorithm, I would have made functionality to make the algorithm change its mind and readjust and recalculate every day. That just seems like it would make more sense in the medical realm, because patients' status changes at least every day. I know that from watching Dr. House. And to be honest, with an artificial intelligence algorithm, this would probably only be like 1 or 2 more lines of code. So I don't know why it wasn't done. In addition, it looks like Boston University's algorithm actually has the functionality to readjust every day. So I don't know why Navy Health's algorithm doesn't. And we know that this is an artificial intelligence algorithm, even though Navy Health says it's proprietary. They told us. Navy Health says that it is an AI algorithm. Artificial intelligence algorithms are used to look for relationships in data that does not have a linear relationship. So, like for example, sick and injured people. Artificial intelligence algorithms take data and separate it into different categories. That 20% of that data is then set aside and called the training set. That data is then used to train the algorithm what to do with the rest of the remaining 80% of the data, which is called the test set. Now, the algorithm will take that 20%, the training set, and feed it through a number of functions that the deep learning engineer has set up. Creatively, they call them layers, kind of like how in Photoshop, everything you do to the picture has a different layer, usually if you're using Photoshop the way most people do. The second to last layer is called backpropagation, and that is when the algorithm basically runs in the functions in reverse, and it looks back on all the functions that were previously done to determine, okay, did this work the way we wanted? Did the training set actually teach the thing to do the thing that we wanted it to do? And then if not, then they can make adjustments to the functions or the parameters, and they continue to adjust it until the algorithm has an error rate of 10% or less. That is the standard operating procedure for anyone who is designing an artificial intelligence algorithm. Now, again, the NH-Predict by Navy Health, according to the lawsuits, has an error rate of 90%. And the AM-PAC algorithm from Boston University that I was able to find research for on Google Scholar has an error rate of 5%. So it is actually better than the benchmark, and Navy Health's is awful. Now remember, Navy Health says that their algorithm is proprietary. Now I'd be willing to bet, if this lawsuit becomes more public in subsequent months, that at some point someone is going to say this algorithm is a black box and there's no way for us to know what's in it, which I've done a video about. So if you hear that, remember, not true, watch my video. I'll link it, I think, here. Every artificial intelligence algorithm has the same framework. So anybody who knows either the math or the coding required to create these can basically create something similar to what Navy Health is supposed to be using.